Let's talk about aplastic anemia. Aplastic anemia is one of the most serious conditions in all of hematology. It represents a catastrophic failure of hematopoiesis. The bone marrow becomes markedly hypocellular, meaning it is essentially depleted of its normal blood-forming cells, and the space they once occupied is replaced by fat tissue. The marrow, which should be a bustling factory of blood cell production, becomes nearly silent. The result is a profound pancytopenia. All three blood cell lines crash simultaneously. But there is an additional and particularly revealing finding: reticulocytopenia. Reticulocytes are the young, newly released red blood cells, immature cells that would normally be visible in the circulation as evidence that the marrow is actively producing. In aplastic anemia, reticulocyte counts are severely depressed, which confirms definitively that the problem is a failure of production rather than a peripheral destruction of cells. The marrow simply is not sending anything out. Most cases are immune-mediated, involving cytotoxic T-cell destruction of hematopoietic stem cells. One important nuance: the source material uses the phrase greatly diminished hematopoiesis rather than completely absent hematopoiesis. This word choice matters clinically. It implies that aplastic anemia exists on a spectrum of severity. Even in advanced cases, tiny residual pockets of hematopoietic activity may persist within the marrow. Patients with severe but not absolute marrow failure may respond differently to treatment, including immunosuppressive therapy, compared to those with near-complete marrow destruction, who may require bone marrow transplantation. Causally, aplastic anemia is strongly linked to toxic drugs and chemicals, including certain antibiotics, chemotherapy agents, and industrial chemicals like benzene. Classic exposures include benzene, chloramphenicol, antithyroid drugs, and certain viral infections, especially non-A, non-B, non-C hepatitis. However, a substantial proportion of cases are entirely idiopathic, meaning no identifiable cause is found despite thorough investigation. In these cases, an autoimmune mechanism where T cells attack the marrow stem cells is believed to play a central role. In the next section, we will talk about anemia of chronic disease. As a quick summary, the diagnosis requires pancytopenia, low counts in at least 2 out of 3 peripheral blood cell lines, with a hypocellular bone marrow, usually less than 25% of normal cellularity, in the absence of significant dysplasia or marrow fibrosis, confirmed by bone marrow biopsy. Severe aplastic anemia is defined as bone marrow cellularity less than 25% of the reference range, plus at least 2 of the following: absolute neutrophil count less than 0.5 times 10 to the 9th per liter, platelet count less than 20 times 10 to the 9th per liter, and absolute reticulocyte count less than 20 times 10 to the 9th per liter.